So hello everyone and welcome. Thank you for joining us. We still have participants coming in slowly, but we would like to give this webinar a soft start. So thank you for joining us on this occasion. So good morning, good afternoon, good evening, good day to all of you. Wherever you are in the world. And we are very happy to open this webinar of the European Partnership for Brain Health on advancing global science collaboration for brain health. So my name is Frédéric Destrebec. I'm the Executive Director of the European Brain Council, one of the partner of the partnership, and dealing with the work package on global collaboration and international dialogue. I'll be moderating this webinar for the 90 minutes to come, and I will introduce the speakers and run the conversation. So this webinar is very much thought as a platform for dialogue, exchange of ideas, collaboration. So we would really invite every one of you in attendance to contribute to that conversation in a positive and constructive way. And I will be asking you maybe to log your comments into the chat and Q&A function of this Zoom meeting in order for us to be able to collect that and address it with the contributors and the speakers of today. So I'll simply would like to introduce this webinar by reminding everyone as to why we are organizing it, particularly in a context where brain health is increasingly recognized as a global challenge, with profound implications for health systems, economies, innovation ecosystems, and societal resilience worldwide. Neurological and mental health conditions are the first cause of disability in the world as we speak, and the second cause of mortality. And we obviously look forward to it becoming even more of a pressure with demographic change, environmental issues, growing inequalities, and we see the impact of brain disorders to really worsen over the years ahead. At the same time, we see major scientific and technological breakthroughs. It is opening unprecedented opportunities for prevention, diagnosis, treatment, and care. And we still face some deal of fragmentation across research systems, funding landscapes, regulatory frameworks, and policy approaches. And this is limiting collective progress. So that's where the European Partnership now aims to strengthen Europe's role as a global actor in the brain research and innovation space. And in doing so, we'd like to foster international collaboration and strategic alignment across regions. So this webinar will seek to create a platform for dialogue and exchange between stakeholders. So we have speakers from Europe, Latin America, Africa, Asia Pacific, and beyond. And we aim at identifying opportunities for global collaboration in brain health and research. And we will be focusing on strengthened international science collaboration, identifying common priorities and shared challenges, fostered synergies between regions, improved coordination and knowledge exchange, and reinforcing the global positioning of brain health with broader policy and innovation agendas. So on that note, and within this context, I'm extremely pleased to introduce our first speaker of today, Katharina Sadler, who is Senior Scientific Officer at the EP Brain Health Coordination Office at DLR in Germany. So Katharina will introduce the European Partnership for Brain Health to bring us, I would say, up to speed with the concept, the details, and the development so far with the EP Brain Health. So Katharina, you have the floor.
Thank you, Fred, for this nice introduction. Yeah, Katarzyna Zädler, I'm part of the coordination team for the Brain Health Partnership. And I'm super happy to introduce this today to you. So to kind of start off the discussion, what the partnership wants to achieve. And I'm sure I will repeat a few of the points that Fred already mentioned. And I will start my presentation for that. Just have to, and then I have to change how it's presented. So I guess you should be seeing the first slide right now.
Yeah, absolutely perfect.
Okay, perfect. So I will start by asking the question, why brain health? And Fred already mentioned that this is a topic that receives more and more attention. And we are actually facing huge challenges in the field of brain health in Europe and worldwide. And I will always say Europe and beyond, because this is not solely a topic for Europe, but for the whole world. And but when focusing on Europe for now, we know that 1 in every 3 Europeans actually suffers from a neurological condition. And worldwide, it is estimated that it's actually more than 3 billion people that currently live with a neurological condition, and around 1 billion with a mental health disorder. So neurological and mental disorders are really, as Fred already said, a leading cause of disability and the second leading cause of death in Europe. So this is something really to consider. And it is estimated that 443 million years of healthy life are lost due to illness, disability, and premature death caused by brain-related disorders. And Fred also pointed out that we are also facing demographic changes and also current geopolitical and environmental crisis, and also increasing economic pressure in many countries in Europe and beyond. And this actually has aggravated the health problems, particularly for the most vulnerable populations. And so consequently, the burden of disease and the economic cost of brain disorders are enormous. And there is a recent study, that's COIN EU, that actually estimates the cost to be 1.7 trillion euros per year related to brain disorders. So this is massive. And therefore, maintaining brain health and also coping with the burden that is caused by these disorders is actually paramount for all societies in Europe and beyond. And but in spite of all the efforts that have already been done and all the investments in research and innovation within the last decades, one must say, effective prevention strategies or therapeutic options for mental or neurological disorders are still lacking or are not accessible to everyone. And however, given the scale of the program as I just presented, no single country can or discipline can tackle these challenges on its own. But we need a holistic and collaborative approach for this. And therefore, we are here today. This is the next slide. And about the fragmentation that Fred also mentions. So there, for let's say 2 decades, the EU has funded several large initiatives and programs that have been established to structure and align brain research in Europe, and also enhance coordination and cooperation. And some of those initiatives you might know, those are, for example, the Neuron and JPND initiatives that were mainly funding research, but also the former CSA EBRA and the Human Brain Project, and the implemented infrastructure eBrains. And all these initiatives have helped to advance the knowledge of neurological, neurodegenerative, and mental disorders. But despite this effort from these initiatives, the landscape was largely fragmented, mainly because those were parallel programs with distinct objectives and also their own funding motivations. Where is it? Yeah. So the creation of the European Partnership for Brain Health is really a deliberative attempt to move beyond this fragmentation. And this is what those two pictures want to show you. So we are not replacing what was there before, but we are bringing it together and also widening the scope under one long-term collaborative framework. And we want to capitalize on these existing collaborations and established structures to allow a holistic approach to brain health and overcome traditional boundaries that were mainly indication related. And for this, we want to involve all relevant stakeholders along the entire transnational pathway. Those are funders, those are ministries, but those are also researchers, patient organizations, and healthcare providers, and representatives of the private sector, policymakers, or regulators. And in this way, we are really trying to implement a completely new, comprehensive brain health ecosystem that in the end offers really tangible benefits for patients and also the society as a whole, and the competitiveness for Europe. And the consortium brings together 64 participants from 36 countries. And we have a very broad geographical coverage. So we have EU member states, we have associated countries like Canada or Israel, New Zealand, Turkey, and third countries like Australia and Taiwan. So it's not just about Europe. So as I pointed out, it's always Europe and beyond. And the vast majority of those partners are public funding organizations. And in exceptional cases, we also have non-funding organizations as partners because they are contributing skills and expertise that cannot be covered by the funders. And those, for example, includes the European Brain Council that is hosting this webinar today. And I think it shows the great success of the partnerships, that we have this collaborative spirit of Europe and also other partners and stakeholders that really want to tackle this important crisis. And the strategic research and innovation agenda was prepared before the start of the partnership. And it defined 4 priorities that are also depicted here. And priority 1 was promoting brain health and preventing brain disease. Priority 2, improve early detection, diagnosis, monitoring, and treatment options for brain diseases. Priority 3, improving treatment, care, and support for people living with brain diseases and their caregivers. And lastly, also the integration of social, ethical, and legal dimensions. And those priorities are then flanked by other activities like the joint funding or capacity building or citizen engagement. And based on the SRIA document, the partnership has one vision, and this is to improve brain health for all, develop scientific knowledge as a ground to promote brain health throughout lifetime, to prevent and to cure brain diseases, as well as to improve the well-being of people living with neurological and mental disorders in Europe and beyond. And for this vision, the mission is to support brain health research and innovation by strengthening translational collaboration and alignment, and to promote the translation of results into tailored solutions for prevention, diagnosis, treatment, and care that is accessible for all. And in order to realize our vision and mission, 3 general objectives have been formulated. And the first is to improve the scientific knowledge around different levels of prevention. The second is targeting solutions for diagnosis, treatment, and care. And also establish a partnership that is a trusted and collaborative structure. And these 3 overarching objectives are feeding into 4 central hubs that have been formulated as a mean to align the efforts and results towards the overarching objectives. And the hubs are focusing on topics that are the core at the core of many EU member states and also the European Commission. And this is increasing competitiveness, accelerating innovation, building capacities for research, and strengthening the brain health ecosystem. There's even like an animation that shows you how our objectives feed into those 4 central hubs. And the partnership has many activities that you can see here that are flanked by, of course, the management and the coordination and also communication activities. Those activities are research funding and monitoring, translation of research results into practice, empower and engage science and society, strengthen collaboration and global outreach, strategy alignment and priority setting, and resources for the future of brain health research. And I will introduce 2 of those activities in a minute. But before that, I want to show you how the partnership involves stakeholders along the entire translation. So, of course, we have the funders who support a wide range of research approaches, so from basic to research, translational, clinical, and also implementation research. But we also have other stakeholders like researchers and patients or regulatory authorities. And each of them are at a different point of this translational chain. And the ultimate goal to include all those stakeholders is really to promote and accelerate the translation of research results into applications. And as I mentioned, I will introduce 2 of those activities. So one of the core activities of the partnership is, of course, research funding. And we have an extensive portfolio of joint transnational calls. So there are a total of 27 calls planned throughout the runtime of the partnership, and those have a variety of call formats. So there will be different formats where researchers can apply, and funders can join whenever the call fits their research priorities. And the national and regional budget that is foreseen for these calls is around 342 million. And there is also top-up funding by the European Commission. And the other activity I wanted to mention, because it fits the webinar today, is this to strengthen international collaboration and global outreach. And activities in these work packages is really knowledge exchange and engagement with international initiatives and global players, also representing the partnership and science diplomacy events, a global brain health campaign, and of course, strategic exchange and alignment with possible future partners. And with that, I will thank you for your attention, and I'm looking forward to the discussions.
Well, thank you very much, Katarina. It's a great overview and fantastic launchpad for webinar. I think that we actually can move slowly into the panel discussion, but as a way to introduce it, I simply wanted to expand on your last slide and the global activities and the global outreach, given it's the topic of today, but maybe to restate the rationale for this, which is basically stemming from what you were actually introducing, in the sense that we recognize brain health as a cross-cutting global issue, as a topic of priority. And you perfectly introduced the way by which the European countries, European Commission, the European ecosystem has decided to act upon it and then create this infrastructure in order to prioritize investment into the space. But in doing so, it was obviously recognized as being of importance to make sure that this would resonate with existing initiatives around the world. And hence, this notion of creating this dialogue and putting the concept of international collaboration within the activities of the partnership. So this is why we are having this webinar. It is one of the key priorities in the work package that we have generated for that, on facilitating the global dialogue on brain health. The purpose being really to identify and connect to existing initiatives, to other stakeholders around the world being active in the space, and with whom we can definitely create synergies, a structured dialogue, to really try and identify areas of collaboration, but also discuss the potential for alignment at a scientific, policy, and societal level on common priorities. So this is definitely the restating the fact that we are faced with a fantastic momentum when it comes to brain health and brain research. And on that note, I'm extremely pleased to introduce our speakers for the panel discussion. We have with us today Mahmoud Bukar Maina. Mahmoud is a Wellcome Trust Career Development Fellow, but is assigned at the University of Sussex in the UK. But Mahmoud, you also had an assignment with the Yobe State University in Nigeria. And I think I can also mention that you were actively engaged within the Society of Neuroscience in Africa, the SONA, and obviously have been collaborating with us in the past quite a lot. We also have with us today Yukiko Goda. Yukiko is the chair of the IBRO, so the International IBRO Research Organization Committee for Asia and Pacific. Welcome, Yukiko. Thank you for joining us. We also have Agustin Ibanez. Agustin is connecting from Chile and is the director of the BrainLat Institute. And we also have, as part of this panel, Louise Parr-Brownlie. Louise is connecting from New Zealand and is the co-lead at the University of Otago, Dunedin, in New Zealand. So welcome, everyone. And I'd like to invite you and join us and start commenting, because we'd like to basically now have a practical input from your perspective on those beautiful concepts of collaboration, beautiful ideas that we just expressed, but we'd like now to enter into the content and the details. But first and foremost, with this first webinar of the partnership in this type of activities, is to try and understand what are your challenges within your regions, the opportunities or the needs for further coordination, but also if there is a willingness for such cooperation. Would there be any barriers or bottlenecks that we need to be mindful of in order to potentially find collective solutions as to how we address those? So practical ways of establishing partnership would certainly be also an item for our conversations. So I'll probably we'll open the conversation by the order of whom I've introduced. So I'll probably start with you, Mahmoud, and invite you maybe to share with us what's the situation in Africa, but also with your double assignment and also being actively involved in the UK, where you see that there are potential for collaboration and where we could certainly push it further. Over to you.
Thank you very much. It's always great to be back at the EBC to have a conversation like this. So for me, I think I spend most of my time now in Africa because I believe that to push this agenda, I need to be on site. I need to do things right where it's needed. In terms of the question that you asked, challenges, opportunities, and progress. So we've done a lot of work in this area, and especially we've been able to understand, which is not new knowledge, that some of the challenges that affects brain research in general or brain health development in general has to do with infrastructure in Africa, capacity, as well as funding, which is common across regions. But what that means is that it affects also the types of research done, the type of policy documents being produced, and therefore even government interventions that could come into place. And also it slows down global progress because it's not, we should not probably view this as an African, Europe, Latin America problem. There are certain things that are shared across. And an example is in Africa, in the dementia space, no GWAS, genome-wide association studies has ever been conducted. And that is a very, very a lost opportunity for the global brain research. Because when you have such type of data, you can now begin to understand how different populations influence different disease risks or even the mechanism of resilience that can help us advance our understanding in this space. So the lack of infrastructure has really inhibited that from happening. But there are a lot of opportunities. So for example, Africa has the highest genetic diversity of all continents. And we know that that is so critical. I always give this example about ApoE4, which is the greatest genetic risk factor for Alzheimer's disease that we know of today. Only that if you look at it by ancestry, you see that the influence that it has on Alzheimer's disease development, is increased if someone is a Japanese or they are European, but if they are African, that is attenuated. So the key question is, why is that the case? By studying that, we have huge opportunity. So that the genetic diversity angle is a huge opportunity. And also we have unique clinical population. So in Africa, unfortunately, there are different diseases, there are different challenges, that are linked to socioeconomic status, linked to, different climate trajectories, etc. And that gives uniqueness to the continent. And of course, also we have diverse flora and fauna, which also is another opportunity. Now, quickly about progress, a lot of things are happening. And especially in the dementia space, I think there's a lot of things happening. At the moment, we have a consortium called the African Dementia Consortium that tries to map out the kind of genetics of Alzheimer's disease across the continent. And in my own region, northern Nigeria, which is one of the most populace in Nigeria, and also one of the least studied. In fact, no medical research has ever been conducted in the genetic space in that area. We are building a cohort of people with dementia. We have now over 1,300 people with the genetics in the pipeline, fluid biomarker in the pipeline. We have a lot of things being planned for that, and I think this opens a lot of opportunity for the global population because this is a very, very unique, multi-ethnic, and ancestral population. So I'm going to stop over there. Yeah, but I think there are a lot of progress happening, which is quite exciting.
No, great. Thank you, Mahmoud, and quite a handful of issues we can come back to in the course of our conversation, and I'll take advantage of that to inform everyone in the audience to really put your questions in the chat, and we'll be considering them for the conversation afterwards. Turning to you, Yukiko. And welcome and thank you for joining us. We would be very interested in hearing from you from your perspective from Japan, but also from the Asia Pacific region in your capacity of chair as the IBRO-PERC Regional Committee in Asia. Over to you.
Thank you very much for having me. When I'm not with IBRO, I'm actually a professor at Okinawa Institute of Science and Technology in the southern island of Japan. So I've been involved in IBRO for past 5 years, 3 years as a committee member, and the past 2 years as a chair of this Asia Pacific Regional Committee. And I'd like to briefly introduce you IBRO as a whole, and then go into the Asia Pacific specific issues. So IBRO, International Brain Research Organization, strives to provide diverse and equal and inclusive access to global neuroscience. And specifically, this is by coordinating various research training opportunities, promoting international collaboration and exchange, providing opportunities for career development, and also supporting dissemination of brain research, in that IBRO has 2 journals of its own. And IBRO consists of 5 regional committees. There's US, Canada, Latin America, Pan-Europe, Africa, and Asia Pacific, of which I'm part of. And to implement the goals of IBRO, the major task of these individual regional committees is in overseeing grant schemes. And this is mainly 2 channels. So one is career development, and the other is event organization. This is to promote collaboration and so forth. And in the career development part, there's exchange fellowships to promote researchers to go abroad or to learn different techniques, or to further collaborations. There's opportunities for training grants for students to go to specific courses, for example. There are early career awards. It's called Rising Star Awards, and this is for newly appointed faculty to boost their research. And then we also support schools, IBRO-supported schools. And in the event organization category, we support annual meetings of various societies. People could apply for funding to support speaker for an event that they're organizing. There's also support for Brain Awareness Week grants. So this is in part collaboration with Dana Foundation. And this is more towards the public as opposed to researchers. And also there's Seeding Neuroscience Grants. This is a relatively new scheme to promote starting of the sort of an infrastructure of an organization to that, aim towards building some neuroscience network within the local area. Okay. And as throughout my experience, so I think the IBRO and especially APRC, we have been highly effective in promoting international collaboration through these availability of these grant schemes, and also to support emerging neuroscience communities at the same time. But the main difficulties that we faced is that Asia-Pacific Regional Committee is not only geographically broad, but it represents nearly 50 countries of culturally diverse but very different economic wealth based on World Bank income classifications. So for APRC, we cover Far East from Japan, China, and South Korea, Oceania, New Zealand, and Australia, Fiji, Southeast Asia going to Indonesia, Philippines, Vietnam, and then India, Nepal, Mongolia, and Pakistan, and all the way to Middle East, Saudi Arabia, Iran, Israel, Oman, for example. So it's really, really geopolitically sort of not dynamic area. But so the challenge is to how to equitably support neuroscience across these different countries and regions with distinct needs. So, for example, if you have an opening for exchange fellowships or training grant applications, we get applications from different countries, with different needs. And then we have committee members. We have 9 committee members representing different countries. Also, we try to diversify the membership. But then how do you evaluate equitably? It's comparing apples and oranges. And so that's been a major challenge. And even within a single country like India, who's it's not the only country, but it's a huge country, and there are hotspots where neuroscience is incredibly highly advanced. But then there are small villages where some condition of neurological disease could be not really well appreciated and considered more of a voodoo type of not accepted disease condition, that it might carry some sort of a stigma, for example. So so that's been the challenge in trying to organize this. And also, as mentioned by Mahmoud, I think the existing of certain infrastructure to support growth is absolutely necessary, especially coming from IBRO, and which is a nice international organization, so we can go beyond sort of restrictions of individual, governmental or some societal boundaries, and have sort of more of an international standards. But at the same time, if there's no infrastructure, so even despite we try to fund, the money sometimes may not be well used. So the thing is how best to make I think all the availability of all the resources. So I'll stop here.
Okay. Thank you, Yukiko, and thanks for adding to the list. And again, a few items where I see, let's say, some crossing with other contributors, but we'll carry on collecting everyone's introductory statement, and I'm pretty certain we can come back to some of those, particularly issues related to cultural elements, but also what you mentioned about stigma. That's probably also issues we should come back to. Agustin, I'd like to bring you to the fore. Thanks for joining us. I know that you had a busy agenda today, but very glad to give you the floor and get the perspective from your end on behalf of BrainLat. Over to you.
Thank you, Fred. It's a great pleasure to me to hearing what you say is so relevant and also very interesting in this discussion. And I will start with the challenges, and then I will turn into the opportunities. I will start with something that it's a little bit strong, but I think that is true. We are all talking about global brain health, but doesn't exist. That is the true. I mean, I'm the director of the Global Research Network of the Global Brain Health Institute. So you see the word global twice there. The GBHI, coordinates 300 fellows across 60 countries. Is huge, and we work a lot with Latin America, Africa, and Asia. So how I can say that? Well, the fact is that beyond these efforts that we are doing, there is a huge disbalance, and this balance we could be talk hours. Is from basic research, data sharing, diagnosis, characterization, therapeutics, and founding. So I think that it's very important for us to understand what are the real challenges, because sometimes we tend to be over-optimistic regarding what we do in global settings. And let me clarify what are some of these challenges, right? So first of all, like 90% of what we know is not global. It's coming from the 10% of the population. And this is not only in geographical setting. It's not that all that we know come from the north, but also in the north, minorities are not included in there, minorities that sometimes are a huge amount of people, right? So this is the first thing. The evidence that we create is really biased. Beyond all the big effort of federated learning, data sharing, all of this is a problem. It's not the only problem. I think that the most important problem associated with that is that we think disease or health or brain from what we see in those contexts, and we ignore many other factors, from physiopathological factors to risk factors to therapeutics that happen in other contexts. And this is not any bad intention about that. It's a consequence of the limitation of the approach. But it's a real truth. When we talk about data sharing, we are extremely happy that we are, Africa have 2 consortia for brain health. They also have the APCC they integrate 45 cohorts. Latin America, I have the pleasure to direct the BrainLat consortium that is running across 13 countries. So this sounds wonderful, but in real numbers is extremely small. It's extremely underrepresented, especially, the kind of deep phenotyping. If you think in the all of us consortia or cohort in US or the UK Biobank, because the huge phenotyping, the huge characterization in biological terms, these cohorts drive the questions, drive the potential pathways. And we are absolutely blind to try to do this kind of assessment in other settings. So this is, then with data sharing, there are many problems for harmonization, many problems for data curation, many problems for real doing federated learning. It's extremely hard to do federated analysis, running the analysis in your local setting when you don't have the basic infrastructure. So there are big challenges for that. Then when we talk about diagnosis, I work in dementia, for instance. I don't think that the basic diagnosis of the pure biological definition, the ATM framework, is going to work in global settings. Why? Because dementia doesn't care about being totally, separated from cardiometabolic health, vascular components, the cumulative burden that happen in life. In fact, dementia is intrinsically, connected with all this process. So we are not going to capture dementia with a basic amyloid, tauopathy, and neurodegeneration framework, that's for sure. And I don't think that is even going to work in all the populations in the global north. The degree of vascular components that impact Alzheimer's disease are very well known. The more than 75 different pathways beyond tau and amyloid are very well known. So this is, again, it's a kind of multimodal diversity, not just the diversity in race or data or, gender. It's much more. Then when we move into therapeutics, it's the same. I think that is one of the most exciting times with the monoclonal antibodies. But the degree of just validation in underserved population is extremely small. We don't know practically nothing. And at the very least, when you do biomarker research in the global south, still these biomarkers work, but they don't work at individual level. They don't work at very early stages. So once again, it's the same history happened then. And then when we think, in therapeutics, how we can implement monoclonal antibodies in the global south when we don't have CSV or PET, we only have plasma, so we won't be able to validate plasma against, other gold standard things when we don't have. Of course, there are hot spots, and I like, Yukiko, your expression, because there are incredible hot spots in the global south that this is a wonderful that we need to promote and support, but it's not enough, right? It represents a very small thinking. And the last point that is underlying all of this is funding. Funding is a huge challenge, even when, NIH for many years has been supported global research as any other organization in the world. And these now have changed a lot. Still, of course, there will be opportunities for global foreign components. I have a large consortium that is founded by NIH, 19 million for that, so it's possible, but it still is incredible more restricted. And when you look to European funding or other fundings, it's really, really a challenge. And the problem is that we don't have local support. That is the big challenges. Governments in the global south have so many big issues that they don't invest for the long-term future, right? So this is the map, and this is why I say we don't have a global brain research agenda, really. We want this. We want to move forward, but we need to be aware about that. And don't be so negative. I'm now taking a few minutes on what we can do regarding all of these points. I think that for data sharing, that we need to do is working with organizations like global stakeholders. It could be the Alzheimer's Association, the Davos Alzheimer Collaborative, the Gates Foundation. We need to develop not only, infrastructure for data sharing. We need to develop the capability for the people for doing their own analysis. We need to train the people. Nowadays, it's more easy. We really can develop that, but we need to make it at a scale, not, in 2 or 3 cohorts that we have identified. So we need to, probably multiple stakeholders should think seriously in that and create strong global platforms for data sharing, training, and federated learning. Not only saying that we need federated learning or that we do federated learning with 3 or 4 or 10 countries, but creating a coordinated action across stakeholders, because otherwise it's not going to work. For diagnosis and characterization, I think that they are not only problems, they are huge opportunities. I think that the Global South can bring voices, can bring science, can bring new ideas, just because we look at a different reality. So where we look is where we think. And in that point, it's very important to acknowledge, for instance, that the focus on saying, hey, brain health is more complex than 2 or 3 markers or one single therapeutic pathway is something that resonates across the Global South. And most of the researchers in the Global South are extremely aware of that. One of the most important genes for future of gene therapies for Alzheimer's, 2 of them or 3 of them has been discovered in Latin America, for example. The paradoxical contribution of ApoE4 in African populations come from African populations, right? The incredible important idea that there is a biological embedding of the environment, and we need to tackle from pollution to socioeconomic inequality, not only, as risk factors, but truly biological drivers of health of disease, is something that I think that the Global South has contributed a lot. Same for therapeutics. I think that the idea of developing therapeutics that will need, for instance, for aging and especially for dementia, they must be in the future a combination of pathways, come from this idea that dementia is not a single entity, that is not a single physiopathological pathway, that we need to address cardiometabolic. Cardiometabolic health is is the biological counterside of the socioeconomic disparities. And we really need to incorporate cardiometabolic pathways if we want to think in therapeutics in the global south. So I think that those are the points. And for founding, at the very least, I think that there are many cohorts and consortia that will be able to attract larger funds in the global south. The rising of these really global stakeholders like the Gates and others, or the role that Alzheimer Association is starting to having, for more global settings. And I hope the role of the European stakeholders in looking at global settings in a very serious and responsible way from UK Biobank, from European Commission. I think that this can be really, really an opportunity. After this, we will be able to talk about global brain health.
Well, thanks a lot, Agustin. It's quite a interesting array of different issues. And you made me think about the saying that, when you want to create change, of course, you need funding and you need money. We are getting there. And obviously the partnership is a first commitment. It's probably going to initiate elements of change, but you also need the people in the ecosystem and you need the ideas. So I think that with gathering and creating those networks and engaging this collaboration, we are getting there in getting the right people around the same table. And thank you for contributing, let's say, so many ideas there. And we are probably making progress on identifying how to scope for a common agenda. And before we go into the depth of the conversation, I'd like to introduce our last contributor on this panel. Over to you, Louise. Maybe also giving us this perspective, given that you represent New Zealand as one of the associated partners within the partnership. It would be interesting also to hear from you what has triggered this interest, but also where you saw that there were common challenges and opportunities for collaboration there. So over to you, Louise.
Thanks, Fred. I'm really delighted to be here today. So New Zealand is on the other side of the world, yet we are an associated country in Horizon Europe, and we bring strong connections to the South Pacific and to the Oceania regions. A significant challenge that we face is reduced investment funding, as was mentioned earlier. So that has meant that we are reimagining how New Zealand's science is going to maximise its contribution on the global stage. And right now, the New Zealand science sector is undergoing a once in 30-year restructure to ensure areas of strategic importance are supported appropriately. And that means those areas that meet New Zealand's specific needs, unique strengths on the global stage, and areas where we need to grow expertise for the future. Brain health research is strong in New Zealand. And I'm going to give you two examples. So birth cohort studies with greater than 90% retention over 52 years and includes lifelong psychological and behavioural data, plus MRI scans from 45 years of age. And a second example is Indigenous-led research with a holistic view of the brain and innovative and sustainable intergenerational ways to keep people well. So reimagining New Zealand's future in science created an opportunity. We are in the Brain Health Partnership because our Ministry of Health saw that the strategic opportunities created by our participation, whether that's at the bench, in the clinic, at data labs or elsewhere, and from opportunities to influence the European system, but of course also to learn from it, and opportunities for science diplomacy. So our ministry saw that the benefits for New Zealand's participation were going to be many, many-fold greater than the sum invested. And that means it's an incredibly wise investment. Global science is the only way we're going to solve the wicked challenges facing the world, including in brain health. The Brain Health Partnership is creating opportunities for new collaborations to conduct transdisciplinary research that finds novel ways to diagnose, treat, or slow the progression of brain conditions, and equally importantly, maintain brain health throughout the lifespan. And New Zealand, with a population of 5.5 million people, can't solve brain health challenges alone, but we are very happy to be part of the partnership. So some of the a specific issue or a couple of specific issues that we're facing, probably like some of the other countries that from the people on the panel, we are very close to having a super aging population. And that means that all the disorders of the brain that occur with aging are going to be dominating our healthcare and our healthcare needs. So there's going to be much greater need, much greater costs, but actually there's less money going into our health system than there has ever been up to date. And given that we're a small population and our demographics are changing so markedly, it's hard to understand how economically we're going to actually solve this and maintain a truly viable economic country as we go forward. We've got significant challenges. Thanks.
Thank you, Louise. But are you suggesting that brain health investment and brain research would be identified as a driver there?
Yeah, absolutely. I mean, it's so important that we contribute to that global opportunity, so that we contribute to the general brain health solutions that need to be found, but also really target in on some of the ones that we've got that we need to really address. And one of our biggest challenges is actually the disparity in health equity for our Indigenous peoples.
Awesome. Thank you, Louise. Okay, obviously we heard from every one of you there is a kind of like quite a number of issues, let's say, laid on the table, and that you have singled out. I'll probably would like to offer you the opportunity to expand and pick up on what others have said. So Mahmoud, I'd like to come back to you if you saw kind of common points or commonality of or let's say like-mindedness with some of your co-panelists, but also if you see issues coming across the needs and opportunities that you identified, where would you like to push it further?
Thank you very much, Fred. So yeah, definitely many commonalities with what Yukiko has said and Agustin as well. So I'll probably go back to what Agustin has said a lot around cohort and data integration, then kind of try to now link it up with what Yukiko has mentioned, especially with what Ibro is doing. So the key thing that I always tell kind of panels when I sit on them is that there is no single answer that can come from a single region or a single country. We have to all collectively work together to ensure that we improve brain health. And in the area of, in this space, therefore, looking at it from the African setting, because I sit on the SONA kind of executive committee, and also I advise the government of Yobe State, there's a huge opportunity that like was mentioned, in this cohort development, from multi-ethnic groups, especially in the dementia space. Now, one of the major problems is that when you have a cohort, for example, in Nigeria or in Kenya or in Ghana, how do you harmonize that kind of, kind of phenotyping with cohorts within not just Africa, but outside Africa? I think this is one of the major areas where international collaboration can come in. So, for example, what we are doing, even within the African setting, is there is this project, Africa Fingers, which is based on the Worldwide Fingers project, where we are also co-leading aspect of that in the northern region. And what we've sat down to say is that perhaps the different groups working in dementia, what we want to do is to see how we can harmonize our batteries. Sorry, there's an alarm here. Let me just off it. So perhaps what we want to do is to see how we can harmonize our batteries so that across all the regions from within Africa, the batteries that is being used for cognitive phenotyping, for example, and perhaps even, in terms of the pipelines that we use for GWAS or for fluid biomarker, how do we harmonize it as much as possible so that it can be kind of comparable And therefore, when we now begin to make this comparison with other cohorts, outside Africa, it will become less challenging for interpretation. And that's where data kind of harmonization and integration comes in. But here, there's a big issue that I see often happening, especially in areas of international collaboration. Most of this international collaboration are being driven by funding from outside. And unfortunately, that means that the agenda is not necessarily being set by the researchers, local researchers. I've seen a lot of this, without mentioning names, where the research agenda, sample collection, and everything is being dictated by the international collaborators where the funding is coming from. And I think that is a very, very problematic way of doing the science, especially within the African setting, because of the mistrust that have been happening, because of such opportunities that people have been, people have been taken advantage of. So I think we need to kind of like change that perspective to ensure that there's an equity, there's a leadership. When it comes to these unique data sets, the unique types of cohorts, the leadership, the data ethics is being led locally. Now, this brings us to the issue of, therefore, workforce development. And I think IBRO has been doing a lot of things. ISN, International Society of Neurochemistry, and others have been doing a lot of things. I think what we really need is we need more people trained in this space that can continue to drive this type of research, build more collaborations that can build a sustainable ecosystem. Now, it's already happening, but another thing that is great, but also is not really entirely great for the continent, is that most of this training happen either in Europe or in North America, etc., which is great. But then people end up seeing this fancy environment and fancy things that they decide not necessarily to come back to Africa, or they decide to stay elsewhere and do helicopter science, which is not a problem, but it kills the sustainability of science locally. So what we have always done, because we've been running workshops as part of Trend in Africa, which, I'm a director of Trend, focusing on building capacity in neuroscience in Africa. We've been doing this for like 13, 14 years. What we've always done is to say, how do you do this such that the people in that local settings will see that it's been done locally within their own realities? Electricity, when you are organizing a workshop and the electricity is just gone, and there is hot, weather, and there are kind of like obstructions here and there. So we try to ensure that such capacity building is done locally, because people will see that it's being done within their own realities. And therefore, if it is done within their own realities, they will now find it more useful to implement and build more stronger research the directions. So I would say that to put everything together, we need this data harmonization, data integration across cohorts, across the world, and this can only happen via international collaborations. But these international collaborations should help to ensure that the local ecosystem is empowered through equitable leadership, through trainings that are happening locally, and also through respect for the local kind of communities where the data is being generated.
Thanks a lot, Mahmoud. I think it's really clear and really bringing us forward there. Yukiko, how do you resonate? Because Mahmoud was identifying commonalities with some of the things you had been mentioning. How about what he just said about local empowerment and recognition of local realities and potentially other topics? Over to you.
Yeah. Thank you. I absolutely echo with Mahmoud in terms of there is a big gap between the researchers who's at the other end, and then perhaps the funding organization, let it be. And there is also, I think Agustin mentioned the local support, governmental level, that sometimes it doesn't go along, so it just comes in between. And I think, first of all, it's important to have all these this type of dialogue. And quite often, my colleagues, they're researchers and they're in their own bubble. So they're worried about their own research projects, getting their own funding, maybe collaboration within their own project. And, I think everybody needs to start thinking about the shared experiences and promoting the global health that's going to affect everybody and all our children and all our descendants. So it's promoting this type of thinking. I think it's really important, and the only way is to have more of these conversations. And I feel that this is I touched upon briefly, sort of frustrations in some ways to how to implement equitable support, inclusivity, and I think the regional and the local societies might want to play a bigger role in buffering, serving as a buffer. So what's the international organizations are good at having a really broader view and organizing funding, etc. And then there are researchers in their individual pockets in certain countries, different culture. But then in the end, so this individual and talking to other collaborator on the other side of the world may not be as effective. But then I see this quite often in the Asia Pacific as well, because we have many society organization. But then so they need to be aware of the needs of international collaboration, because they can make a difference in having more implementing sort of communication and awareness more at the local level, which is going to make it much stronger over time. I think it'll take time, and so it's increasing awareness, perhaps educating the. I shouldn't say educating, but having more people with science background, actually research background in government, for example, that could make a big difference. Yeah.
Okay, thank you, Yukiko. We could certainly come back to that as well. But Agustin, I saw you nodding quite actively. I think it was on the issue of researchers' isolation, or was that about another topic?
I was thinking more general, what has been said across the panelists. I think that the one point is, how to value local, let's say, local support through ideas or training researchers or, local institutions. And I hear very attentively what Louise say about superagers. And one example of this for me is the study of resilience. Resilience is something that is becoming more important. Not resilience in the classical sense as cognitive resilience, that is a very narrow, it's important, but it's very narrow concept, right? Like resilience in general. When you think, there are wonderful examples how local, because resilience emerged in the local settings against the local setting, let's say. You have terrible surrounding and you have a person that never developed the disease. And this opened a unique opportunity for discovering. I want to mention some examples like the mutation, the Christchurch mutation or the Colbos mutations are protecting against Alzheimer's. So if you have presenilin 1 mutation, if you have this another one, you don't develop AD. And this is an example that Francisco Lopera discovered in Colombia, because they were studying families with this mutation. 99% of these persons should develop the disease, and they didn't. So this is the example of why resilience is so important. Psychological resilience is also extremely important, and we tend to neglect that. There is probably, I will say in a very wrong expression, but there is an Ubuntu word that is ukufumelela or something like that, that is talking about becoming victorious in the face of adversity, no? Like collective, I'm based in the idea of collective resilience. This is something that Africans and Latinos have a lot. The familismo, we call it in Latin America, the bonds of the families to create, strong bonds to reduce the inflammation, the stress, to reduce the impact of environmental demand is something that I think that the lead of the African finger, is developing a wonderful study on this kind of resilience, how this impacting, in the inflammatory pathways, for example, right? So these are really good examples. Then even social values. We have published how sociopolitical factors induce accelerated aging. And now we have another paper looking at the societal values, how values are really, really having an impact in the health of the people, right? The exposome research in general, right? I've shown, unfortunately, exposome is associated only with negative things, like the adverse exposome. But definitely, you can look at that with a different optic, like how much green spaces improve your quality of life. How social factors can really protect against other biological factors. So the exposome needs to be transformed also to not only identify negative aspects like pollution, or socioeconomic inequality, but also protective buffers. I think that those are really important and are absolutely neglected in most of the research because we look at disease, right? And the final thing for resilience I want to say is it's also brain health can help economic resilience. I think that we are facing one of the most challenging periods regarding this idea of polycrisis, or how we want to call it, like, facing socioeconomical, political instability, treating our own identity, our own values of, intellectual abilities with AI. So what we really need is people that face challenges, that can face adversities, that have creative thinking, that have social skills, that can, and this means economic resilience. I'm so happy we have just launched at Nature Medicine the Commission for Brain Health and Economic Resilience under this idea. I mean, what makes us humans is our brain health, in the sense that provide our most, relevant skills for survival, for flourishing, and for developing. So I think that resilience is a topic that could be a very global agenda.
Well, thanks, Agustin. And yeah, whether we call it a polycrisis or a permacrisis, but it's definitely, let's say, the trend of the current times, unfortunately. Louise, you were alluding to the fact that you were facing a stage of reduced investment by public authorities, and obviously the point about the role of government and official institutions was pointed to. I wanted maybe to invite you to reflect upon that, but as well as any other topic you picked up from colleagues on the panel. Over to you.
Absolutely. So I'd like to talk a little bit about data, and I absolutely agree that data harmonization is needed so that there can be greater interpretation and use of the data that have been collected. And we don't replicate, like we don't keep getting data sets that we can't get in and get the deepest analyses that we possibly can. But I also want to bring up another point, which is that often data, especially data around the brain, has cultural relevance. And so you can't just separate a culture from a lot of the aspects of the data that we collect. And so in New Zealand, we are absolutely in favour of having open data, but we also do that cautiously. So we often describe it as being the data being as open as possible, but as closed as necessary. So it comes back to the idea that's already been brought up around sometimes people, the data have been extracted, people have been exploited, or cultures have been exploited, and that comes down to data sovereignty. So that when data are being interpreted, the control over how data are analysed and interpreted is by the people or the ethnicities that the data are actually from. Another point I wanted to pick up on was around diagnoses and how historically most diagnoses around brain disorders have been characterized in men, and how often in women it actually presents very differently. So in my own area of specialty, Parkinson's disease, women tend to be diagnosed later, and that is thought to be due to the estrogen protective effect. But once the diagnosis is there, they often have a drug-induced side effect of dyskinesias that comes on really, really rapidly and is very, very strong. So symptoms are presented quite differently, and we need to understand that better to better serve women. But to come back to the point that you asked me about, Fred, it was around what are the roles of government. I see in other parts of the system, so international organisations and maybe regional, but in New Zealand we don't have a regional funder, so I'm going to talk about that just very generally as funders. So governments, everyone in the system, they're enablers. So they're able to set the strategic direction and priorities, and an obvious part that they have to do is provide some funding, but they also create other opportunities. So in particular, governments create bilateral and multilateral funding opportunities when there are aligned interests and aligned values. And there's often science counsellors or science attaches that have diplomacy roles, and science is really good at breaking down barriers and tensions, and is a really good route to have conversations between countries that sometimes may not be that keen to be talking that much. So we shouldn't underestimate the value of the science diplomacy role. For funders, again, they're going to have a role as an enabler. But the nice thing about when it comes down to funders and regions is that that's when you can get the specificity for a particular region that has been mentioned before. So whatever the priority is for a region, the way that it should be conducted, and I really am a strong advocate for patients or person-centered research relevant for a particular region, then that can be a priority and put into the funding stream. And then, of course, any funder, one of the important things is to incentivize what research gets done and how it gets done. All the parameters around the funding that ensure that the right kind of research is done. So what sort of things are essential, what are required, what are optional, and that can be things like brain conditions, it can be things like how the research is done, whether there needs to be equitable outcomes, and a reminder that the real experts when it comes to any knowing about brain conditions and what is truly needed are the people that are living with the disorders. And of course, a funder or a government can put priorities around early career researchers and training. And then on the international stage, and I'm thinking here really big organisations, places like the WHO and the United Nations, that they can enable and they can also leverage outcomes. So and the way that they do that is they identify the global challenges, then they use their platforms to highlight the current situation, what the future is likely to bring, and then make a call for action. It's kind of like, this is where we're tracking. We need to change that, and here's the opportunity. And there are a few ways that that can be done. One of them is United Nations resolutions. So it's a tool to establish a global policy that sometimes can also be used to mandate actions. But there are also other opportunities like having the International Year of something. And it'd be amazing if we had an International Year of Brain Health. And of course, the other thing that happens with these international organisations is it brings all the policy makers, the scientists, the innovators, patient advocates, the funders, and other international organisations into one place to have that global conversation and create those global collaborations.
Well, thank you, Louise, and thank you for this vibrant call for action. Okay, sorry, I think that there is a slight lag in the connection. I didn't mean to jump over you, but thanks for the vibrant call for action, and also the areas of engagement. It's probably a fantastic way to tease for our session that we will have at UNGA, so during the General Assembly of the UN in September, where we will actually continue this conversation, but in person in New York, and that's going to be on the 23rd and 24th of September. And obviously you're all warmly invited to join on that occasion, but also I would say in the future. But I certainly don't want to anticipate words of conclusion and already give the impression that this conversation is over. We still have a bit of time. I'm receiving a few comments in the chat, but one probably sharing the experience in the UK, where there is no a multi-stakeholder platform being set up as a UK Brain Health Foundation. So obviously an invitation to, for partnerships and further collaboration when it comes to the UK more specifically. But as we are nearing the end, it's probably the time to invite every one of you on the panel for a word of conclusion. And obviously we had a very diverse discussion with a lot of different topics. We probably had a deeper dive on data sharing and all the challenges there, which are probably a core issue when it comes to science collaboration. Katrina, I don't know if you'd like to come here to comment on that. And I don't know if you have a chance to maybe mention some of the activities that are specific to infrastructures and data sharing as well. But over to you maybe for some words, and then I'll invite panelists to provide words of conclusion before we bring the webinar to an end.
Yeah. Yeah, thank you, Fred. So when I heard the panelists talking, one thing that stood out is, of course, the lacking funding that locally is missing, and the partnership. When there is no local funder, of course, cannot solve this problem right now. But I think by setting up this partnership and increasing our understanding and also the visibility of this topic globally, we aim to actually engage more and more funders from other regions, and we are reaching out to funders and ministries and authorities locally to engage them in the partnership. And some of them might be interested and have struggled with economic pressure, but that might change, hopefully change in the next few years. So I think the partnership, let's say, can lay the groundwork to raise awareness for this issue, and maybe we can have new partners that join the partnership. And yeah, there are activities in the partnership. I didn't go into all the work packages where it is about resources and data sharing and harmonization. So we have opportunities for people to actually engage in those activities as stakeholders. So this can be researchers, this can be organizations, this can be patient involvement, and we will have different formats of engagement, like workshops or webinars. So this is something that is planned for the future. We just started, so you have to keep in touch with us to learn about all the opportunities that the partnership will also deliver when it comes to resources for the community. And yeah, so yeah, stick with us. It will be a nice journey, I guess, in the next following years. Thank you.
Thank you, Katarzyna. So it's actually also a way to respond to other questions we had in the chat as to how researchers can join and join this discussion on collaboration, but also stay up to speed with the activities of the partnership. So you mentioned in the introduction the funding, of course, which is, I would say, very specific, but when it comes to all the activities, so I'd like to relay to Anna, Beata, and everyone else asking questions about that, what Katarzyna just mentioned. Stay tuned, stay abreast, and join the different conversations and other activities. And it's not only about international collaboration, but there will be other resources
as well.
made available as well. Yeah.
So just one single thing, because the question
Yes.
was asked. So so of course we will publish calls, and you can then apply for calls. But we also have a partnering tool where you can look for partners. So if you don't have a consortium yet and you're interested in other researchers, so just send us an email, brainhealth@dlrpo.de, and then we can give you the link directly to our partnering tool.
Thank you. Thank you very much. So now comes the moment of conclusion. We are in the money time. So I'll probably ask every one of you to maybe say a few words in 30 to 60 seconds, if possible. But it's basically along the lines of, where do you see that we could have or hope for a concrete next step from initiatives such as the partnership, but I would say not only, also beyond, but that ought to be considered as a potential solutions and concrete activities. Mahmoud, would you like to start?
Sure. Yeah, I think for me, just like we did mention the need for data harmonization, cohort harmonization and everything, I feel that there is also a need of harmonization of efforts like EBC, IBRO, Welcome. So I think there is the need for harmonization across different interest groups. Because almost every interest group has things that they are doing, like IBRO capacity building, like welcome fund things. So maybe where that kind of cross-talk communication between the different partners can help us towards concrete actionable steps that can support each region in an area. Like in Africa, I think science diplomacy is very, very important at the governmental level. There is a need for more of that at the, and this can be influenced more at the regional level or even at the international level by, organizations like IBRO, like EBC, etc., etc. So I think if we can come together to understand what is going on and how best each of these regions can best be supported, will be a big win from our own perspective. Thank you.
Thank you, Mahmoud. Yukiko, over to you.
Yes, I think it's hard to add on to what Mahmoud had said, coming from IBRO.
I know.
Like
I should stop starting with him because he says it all so brilliantly. So,
yeah, but I would like to make a pitch that IBRO is coming to the African continent for the first time for the Congress in 2027, September. The symposia call is open, so I encourage all of the participants of this webinar to consider. Thank you. That's a good starting point. Yes.
No, that's great. And it's very, very concrete indeed. And thanks, because it's also an opportunity for us to announce that we will be present with a session and with engagement on behalf of the partnership in South Africa. So really looking forward. Agustin, over to you.
Well, I just want to say thank you, Fred, and the panelists and all of you for creating this space. It's essential. Is without this space, we cannot start even imagine what we can do in the future. So it's amazing. And I just want to say there were two comments about how to help early careers to get funding. And I think that is something that we missed in this conversation and is critical. I have been doing a lot of workshops for the Alzheimer's Association, for the GBHI, in how to write papers, how to, find partners, how the best combination is having people with a strong expertise and very early career that makes them most successful. So, Fred, if you want to organize a webinar on writing grants for US European grants, I'm happy to collaborate with that.
Fantastic. Another tangible word of action, and I think, Katarina, we can embed that in all the work being planned around early career researchers as part of there is a dedicated work package on infrastructure where we are discussing data sharing, but also ECR support. So definitely something we can follow up on. Thanks, Agustin. Louise, over to you.
I would like to share an insight from being relatively new into a partnership in Horizon Europe. We have the joint transnational calls. They are big calls of funding, and we have about 60 funders or partners contributing to the money that goes into the pool. But what we haven't really explained is that each country gets to put in their own national eligibility criteria. And why I'm coming back to this is because we were talking about the regional specificity or local specificity, and that's a way that if any country or any region is participating, that they can make it specific to their country, even though they're working in a much, much larger consortium. So it does give an opportunity for that specificity that isn't obvious unless you're working in there.
Well, thanks a lot. Thanks a lot, Louise. And this is obviously bringing us to the end of this conversation. I really would like to thank you on behalf of everyone involved and everyone in the audience for your active participation in this conversation. It was extremely rich, and obviously we mentioned the challenging context at international and geopolitical level, the context of polycrisis, but also the way by which science collaboration, and science diplomacy is an enabler to bringing down barriers and how to create value in collaboration. Also, in the fact that brain health is a global challenge that requires sustained attention and cooperation, and that there is no single answer, and there is no single answer coming from one country, one region, and that collective effort is very much needed in order to maximize impact, reduce fragmentation, accelerate innovation, but also improve very concretely outcomes for people living with a brain condition. So thank you for also expressing support in engagement and conversations such as this one. This is what we are committed to continuing organizing and doing, fostering in the coming years. So there will be more of these opportunities in the future, online, in person, and at various opportunities such as the IBRO Congress, as we mentioned, but potentially others. So we remain committed really to offer this platform for dialogue, coordination, and long-term collaboration across countries and across regions. So thanks a lot for your active contribution, and we very much look forward to continuing this dialogue. Apologies for the 3 minutes of delay and overtime, but thanks for staying with us. And we wish you all, wherever you are, a very, very good day or a tight sleep, and we look forward to hearing from you very soon. So thank you very much. Take care.